Hello everyone, I'm Dr. Santoshi Nandigam, Consultant Obstetrician and a Gynecologist in Cadence Hospitals, Kodambakkam, Chennai. Welcome to my YouTube channel, and today I'm going to discuss about what can you do to prevent a miscarriage. The most common reason anyone can miscarry is something wrong with the genetic composition of the baby. 1 in 4 pregnancies end up in a miscarriage, and the most common reason is going to be some abnormality in the formation of the baby. I can say with full confidence that you cannot control it. Sometimes it just happens and you need to accept it. But there are certain things which you can definitely have a control on. Vaccination status of the mother. There are certain infections which can cause miscarriages in severe form and congenital malformations or developmental abnormalities in less severe form. One such infection is called as a rubella infection. So when the mother has rubella, she might not completely be manifesting symptoms. She might not really know that she actually has a rubella infection until she gets pregnant. And in pregnancy, the mother's immunity is lowered. So once the immunity is lowered, the infection becomes symptomatic. And one form of symptomatic rubella infection is its capability to be transferred to the baby. So the baby starts to have certain signs and symptoms of rubella infection, and which mostly manifest as congenital malformations, physical abnormalities of the face, of the ears, some kind of cardiac defects. And did you know that we can actually prevent this rubella infection by a simple vaccination? Yes. So this point is not for women who are already pregnant or are planning to conceive in the next 3 months, but for women who are wishing to attend preconception counseling, who want to know, who want to get everything right, check your rubella vaccination status. And if you're not vaccinated for rubella, please go ahead, get your vaccinations done. And probably after a month of your vaccination, you can start trying to conceive. 8th point is watch your weight. So of late, there is a general increase in incidence of obesity in the general population. With increased weight comes lots of hormonal disturbances, metabolic abnormalities, lots of changes in your body, which might not be the most adequate or the appropriate state for you to conceive. So the higher the weight of the mother as with the start of the pregnancy, the higher is the rate of miscarriage. So it's always better to try and reduce your weight, bring all your hormones under control, change all your metabolic abnormalities, and then try and start conceiving, planning your pregnancy. My 9th point would be age. Like I said in my previous videos, I know we are all career driven, we are all professionals, we want to, we have really good ambitions and we wouldn't settle down for anything less. But our ovaries really don't care about our career. All that they know is to give us a good egg, probably help us get pregnant, and they have a set time limit. After that point, the function of any organ in the body is going to decrease. So leave alone the ovaries. So after 35 years of age, the miscarriage rate is increased, the quality of egg decreases, and if you are still working around your career and personal life, I would suggest you always find a balance between them. Do not suffer your personal life because you are career driven or you are wanting to be a professional or you want to be an overachiever. Getting pregnant and having a baby is also important. So the final thing I would say is to trust your doctor. Of late, I see a lot of patients getting multiple opinions, second opinions, third opinions, going on doctor shopping, not really having that trust or relationship with their doctor. But I'm here to tell you that we doctors always wish for the best. We wouldn't really suggest you something which we think is not important or not necessary. It's always better to come for a preconceptional counseling. That is, even before you plan your pregnancy, come talk to a gynecologist, go visit a gynecologist, have a word with them about how you can go through the entire process. Believe in the process. The journey is as important as the destination. Thank you.